Okay, welcome back. In this video, we will continue our video series on pharmacology for health professionals. In this video, we'll talk about chapter number 3, drug forms. Learning objectives for this chapter: name the various forms in which drugs are manufactured, describe 7 different types of tablets, describe the difference between a ointment, a cream, and a lotion, name 7 different types of drugs that come in a solution form, describe the difference between a solution and a suspension, describe how pellets, beads, wafers, and inserts are used as drug forms, and lastly, define the keywords and phrases for this chapter. All right, first off, a brief introduction. Before any drug can receive approval by the FDA, the drug company that manufactures it must clearly state in what form or forms the drug will be manufactured. Now, different forms of a drug are appropriate for different routes of administration. All right, now, some drugs are ineffective if they're administered in a certain form, and other drugs may seriously injure the patient if they're administered in the wrong form. All right, the first form we'll start off talking about is a tablet. Now, a tablet is a solid form, and it contains active ingredients and also inert ingredients. Now, tablets will come in different shapes and in different colors. Some tablets are scored, which means they're able to be broken either into halves or in thirds. This is how you get some prescriptions where you're told to take half a dosage or half a tablet. Some tablets are effervescent, and what that means is when that tablet interacts with water, it forms a large amount of bubbles very quickly and actually will lead to a foam on top. And a good example of that would be Alka-Seltzer. And another type of tablet is called enteric coated. And what that means is the tablet has a special coating on the outside that prevents it from being broken down by acids in the stomach, so it can make it to the intestines to be absorbed there. So the word enteric is a reference to the intestine, or more specifically the small intestine. Now, tablets will come in different colors and different shapes. Some are slow release, if you need the medication to be released over a very long, drawn-out period of time. That's why it's called slow release. Caplets, lozenges, and troche or pastille, those are types of lozenges, but they differ in how they are manufactured. But those terms are still synonymous with being a type of lozenge. It's more of a compressed lozenge. All right, in this image, we have an example of the drug Zantac. A very distinctive shape to the tablet. It looks like the home plate of a baseball diamond. And of course, it has the Z that's etched into each tablet. So that makes it very clearly identifiable compared to any other drug. The pink color, the Z marking that's etched on the tablet, and then, of course, the unique shape. Let's see, focus on healthcare. A survey of pharmacists found that a tablet that has a unique color and a unique shape, and one that has a drug name and dosage imprinted on it, and those that have a distinct aroma were the best combination to help positively identifying drugs and be able to decrease medication errors. Now, nearly 70% of pharmacists report that patients ask them weekly to identify random tablets that they bring to them, or capsules, after they've been taken out of the original packaging. So the FDA advises patients who take more than one type of medication to be able to identify them by size and by shape and by color, imprints, or drug form. All right, in this image, we have another example of scored tablets. Here, this one would be easily able to be split in 2. And here, same thing here. And this one here, you can easily split into 3 equal parts. All right, this image, we have an example of Alka-Seltzer, which is an example of a effervescent tablet. And they start off quite large here. So there'd be no realistic way that anyone could swallow this without having a great deal of pain. But you drop a tablet like this into a glass of water, it forms a large number of bubbles right away, and eventually will give you that foam on the top, and then you're able to drink the medication. Alright, now we'll talk about capsules, also known as cap or caps for short. This is a one-piece gelatin shell with a liquid inside. It can also be a hard shell that comes in 2 pieces that pull apart. And when you pull it apart, you have either granules or powder inside the 2 shells. Here are some examples of capsules. A variety of different colors depending on the manufacturer of the drug and the drug itself. You can see here, the blue and white shells form together. And there's a blue part, there's a white part. And when they're pulled apart from each other, you see the granules that it would go inside. So a quick historical note. Many over-the-counter cold remedies and drugs that were used to treat pain were manufactured strictly as capsules until 1980s, when there were multiple sources of Tylenol capsules that were intentionally contaminated with cyanide. And after that point, many drug companies will manufacture their over-the-counter drugs for pain in a tablet or caplet form, so it's not as easy to tamper with. But many prescription drugs, however, still manufacture their pain reliever drugs as a 2-piece shell capsule. The next form of drugs that we'll talk about is the film. It's a thin, dissolvable substance that will contain a dosage of of a drug. This can be administered either sublingually or transbuccally, so either under the tongue or on the side of the mouth, on the inside of the cheek. And from there, the drug is absorbed through the oral mucosa, and then it will bypass the digestive system completely and go directly into the bloodstream. The next form that we'll talk about is an ointment. This is a semi-solid emulsion of oil and water, and of those two components, oil is the dominant ingredient, and this will be absorbed in the area that the drug is applied to. So this has a local effect on where it's being applied. Our next form we'll talk about are creams. Creams is another example of a semi-solid emulsion of oil and water, but of those, water is the dominant ingredient. This is absorbed into the skin and also has a local effect. Now when comparing ointments and creams, this is how they would look side by side. On top you have a standard antibiotic ointment, and here on the bottom you have a hydrocortisone cream. And just by looking at this, you can tell an ointment will have a much more solid consistency to it, and it will be clear in appearance, and a cream will be much more opaque. Another kind of drug form is a lotion. This is a suspension of a drug within a water base. This is also absorbed into the skin, and this will also have a local effect. In this table, we have a comparison of ointments and creams and lotions, and how they feel, and their appearance, and their consistency, and how they're dispensed. So an ointment will feel very greasy. It will appear very clear. It has a very firm consistency, and is always dispensed from a tube. Both creams and lotions are non-greasy, and they're both going to be opaque or have a milky appearance. A cream will be semi-liquid, and a lotion will be more of a liquid consistency. And creams are from a tube or a bottle, and lotions are from bottles. Another form of drug are powders. These are a finely ground drug. These are what can be found within capsules. Can also be reconstituted if needed. They can be sprinkled on the skin, they can be sprayed on the skin, and they can be inhaled into the lungs. Another form of a drug is a liquid, and there are various aspects. The first one, aqueous. This comes from the Latin word aqua. This is pertaining to having a watery consistency. The opposite of that would be viscous. This pertains to being very thick and very non-watery. So if you were to think of a syrup, like a maple syrup or oil you put in your car, that is very viscous. It flows very slowly because it is so thick. That's non-watery. Alright, other aspects of a liquid drug, solutions. These are drugs that are dissolved in sterile water or saline. They're used for injections, and they can be stored in either a vial or an ampule. Now for ampules, those are a small glass jar that are used for storage of solutions, but the way to access the solution is to break the neck of the ampule. The only problem with that is they cannot be resealed. Once you open an ampule, you have to use all the drug right away, or it has to be disposed of. There's no resealing or restoring a container. A vial can be closed with a rubber stopper or a cap. Those can be resealed and used again later on. Now drugs that are dissolved in a liquid base, those would include elixirs or syrups or tinctures. Now these three different types are related, but they do vary in their composition. Both tinctures and elixirs are going to be alcohol-based, usually. Elixirs are usually manufactured as a dilute product, and they have additives added to them to make them much more palatable for the patient, usually something very sugary and very sweet. Tinctures can be either an extract from a plant or a pure chemical substance, and syrups are typically sugar-based liquids. So all three are considered solutions. It depends on what they're composed of and how they're administered. Alright, this image we have an example of an ampule, a small slender glass. In order to get to the solution that's inside here, in the body of the container, you need to break it open right here at the neck. But once that happens, everything that's in here either has to be used or has to be disposed of. This image we have an example of a vial, a small glass bottle, but it can be resealed, either rubber stopper or a cap that comes with it. Alright, this image we have an example of a pretty standard looking syrup. It could be cough syrup, for example. A viscous solution, a little bit thicker consistency than other liquid drugs. Now many over-the-counter and prescription drugs for pediatric patients will tend to come in the form of a syrup because they are sugar-based. So it's easier to have a child swallow something that's sweet as opposed to something that's going to taste very bitter and very harsh. So making a cough syrup taste like cherry or taste like grape makes it a lot easier for the parent or the doctor to administer most pediatric drugs. The other types of drugs that can be dissolved in liquid base, you can have liquid sprays, or you can have a foam, or you can have a mousse. Again, all depends on what the drug is and what it's treating. Will determine how it's best administered. Then you have drugs that can separate from the base, but evenly distributed throughout the solution, such as a gel or an emulsion. And we're comparing these last two terms, emulsion and gels. An emulsion is a suspension of two liquids that don't mix well together. So think of oil and water, for example. So you have two distinctly different liquids in one general suspension. So you can shake up that container really well and you'll get a suspension of the two ingredients, but let it sit still and they will separate out. And when it comes to a gel is a semi-solid to a solid colloid, a combination of a solid and a liquid, such as a jelly, for example. Suspension, another kind of liquid, where you have fine undissolved particles that are suspended in a water or an oil base. The particles will gradually settle out. That's why it's important to shake to make sure that all of the are mixing well together. All right, another form of drug intake, suppositories. This is a solid base of glycerin or cocoa butter that contains the drug within it. Now these are going to be manufactured in appropriate sizes because these are administered either vaginally or rectally, and also different sizes for an adult versus a child. Now suppositories can be taken orally in an effort to treat yeast infections. Another form, a transdermal patch. This is a patch that will contain a dosage of a drug that gets applied to the skin. And these will release a small amount of a drug over a longer period of time. And drugs that are administered this way have a systemic effect, not topical. So it's going to impact the entire body, not just the area where the patch is placed. A good example of that would be Nicoderm. This is used to help people quit smoking. So instead of smoking cigarettes, this transdermal patch has a slow release of nicotine. So the person still has a contact of nicotine, but it's a slow release of nicotine over a very long amount of time. This is to help wean the patient off of smoking in general. Next kinds, pellets, beads, wafers, and inserts. These will be placed within a body cavity, and these forms will have a slow release drug. Some examples of these would be septopal beads. These are implanted into bones to help prevent a chronic infection. Another example of this would be Mirena, which is an IUD, which is inserted into the uterus to prevent pregnancy. Another form of a drug would be a gas. Obviously, these will be inhaled. A very common example of this would be a general anesthetic given to patients before surgery to make sure that they are unconscious. So as you can see, there are a variety of different ways that you could administer a drug to a patient. It really just depends on the kind of drug you are trying to administer and what is the most effective way to get that drug into the patient to treat what is wrong. This will bring us to the end of chapter number 3 in our pharmacology course. We will continue our course with our next video on chapter number 4.